Diabetes mellitus. Let's talk about this common disease. We're going to talk about type 1 diabetes. Type 1 diabetes is not very common, but it is still affecting millions and millions of people. Thank you for watching. This is Glow in Health for Life. We have two types of diabetes, type 1 and type 2. Type 1 is just slightly different from type 2. For this video, we're going to be talking about type 1 diabetes. Type 2 diabetes we will do in a different video. Type 1 diabetes is this type of diabetes that affects kids. It's meant to be, it says it is juvenile diabetes because it affects from babies to maybe 30 years old, even though it's not guaranteed because now things are changing. Just like type 2 diabetes was supposed to be for older people, but now you can see little kids being diagnosed of type 2 diabetes. But type 1 diabetes, we all know our blood sugar level should be around 70 to 120. That's the range for good blood sugar. What happens in our body when people are diagnosed with type 1 diabetes is because our bodies are supposed to make insulin, and insulin is what keeps our blood in the blood sugar in our cells, and uses it as energy to deliver blood and oxygen to our organs. But what happens with type 1 diabetic patients, their body is an autoimmune. Their body is attacking the pancreas from not making insulin or just making minimal insulin. So they are insulin dependent because their bodies are not making it at all. It's fighting itself. There's really no reason why this happens. It's not like one that is due to overweight or age or different things. Type 1 diabetes is something that nobody has control of, but I came across something that I need to share as well. The type 1 diabetes is supposed to be, it could be genetics, it could be from nothing, or recently it could be from dairy products, cow milk, basically cow milk and some meat. Cow milk has a bovine insulin, which is the insulin that when you give babies milk, cow milk, instead of baby milk before they turn 1, they could get type 1 diabetes. Also, you don't have to feed little babies under 1 year old. You don't have to feed them meat because some meat products contains this mycobacterium. Is like an avian paratuberculosis. This mycobacterium, when it gets in the system of little kids, it could cause type 1 diabetes. Other than that, if you have a young kid or planning to have babies, please do not feed them any kind of cow milk. Give them baby milk strictly until they turn 1, and if possible, do not feed them meat to avoid this type 1 diabetes because there's proof that this could be a cause of it. But if you have type 1 diabetes, it is insulin dependent, and you have to work with your doctor, strictly with your doctor, to be able to keep this under control because of this insulin resistance in the body that is not making, it could result to something really serious. Your sugar level could go as high as 2, 3, even 400, which can lead to diabetic acidosis. It could lead to coma, it could lead to stroke, it could lead to death. And if it's slow, again, it is bad. But because it's not something you could control, it's one of the non-modifiable risks that you could control, we just encourage you to work closely with your doctor. Check your blood sugar every day, at least 2 or 3 times every day, to make sure that your blood sugar is within range.